I was recently reading Barbara Castle's diaries, who was Secretary of State for Health and Social Security before I was born. And in her diaries, she talks about how she was grappling with the crisis in social care. And here we are, some years after, and I will leave that slightly vague, how many years after Barbara Castle was Secretary of State, still discussing the crisis in social care. We have, as Graham said, we've got an excellent panel here today. Many of you will know them already, so it makes the introduction slightly redundant. But Andrea Sutcliffe is Chief Inspector of Adult Social Care at the Care Quality Commission. She doesn't just offer the perspective of a regulator, but somebody who has worked in the social care and health system for 30 years or so. And next to her, and who speaks second, is Jacqueline Cannon, Chief Executive of the Lewy Body Society. She brings not just the perspective of someone who leads a membership organisation campaigning for change, but somebody who has cared for her father through dementia and will be able to speak to us today about many of the challenges that carers face in these circumstances. Heather Wakefield, who is Head of Local Government at Unison, a journalist, social worker, policy officer, campaigner, trade unionist. She will speak to us today from many perspectives, but as a dedicated and long-time campaigner for change in social care. Dominique, who is Chief Operating Officer at the Good Care Group, which was founded in 2009, and is one of the leading home care providers. She perhaps speaks not only as someone who works in the sector, but from someone who has a long experience outside the social care sector, having worked in food industry, I believe, before joining the home care, before joining the Good Care Group. Finally, Martin Green, who many of you will know, but continues to surprise everyone, because not least because he immediately told me that he was a member of the National Liberal Club, so I'm not sure if he's hosting us or not formally today, but apart from membership of these grand organisations, Martin is a Chief Executive of Care England, which is the largest representative body for care services in the United Kingdom. He is also a visiting professor of social care at Buckinghamshire New University, so speaks today as a participant in the sector, a champion of it, and an academic. So the panel will speak for 7 minutes, and being such an experienced and talented panel, they will speak for no longer than 7 minutes, otherwise Phil will throw something at them, and after that there's an opportunity for questions from you all, so thank you.
Thank you very much for that, and I will therefore set my watch and try and be as quick as possible. So my name is Andrea, I am indeed the Chief Inspector of Adult Social Care, and it's a pleasure to be with you today. And it's really well timed in terms of where we are today. Oops, right, I've lost it. I don't work with technology. So it's a really good time for us to be here today talking about this and following on from the State of Care report that the Care Quality Commission set out just 2 months ago now, because today is the 1st of December. And we said at that point that we thought that adult social care was approaching a tipping point. So I just wanted to set the context really for our discussion by reflecting upon that. So for those of you who don't know, and I'm sure a tremendous number of you in the room do know, the Care Quality Commission exists to make sure that health and social care services provide people with safe, effective, compassionate, high quality care, and we encourage services to improve. The way that I choose to describe that is to refer to the mum test, to ask my inspectors to say to themselves, is this a service I would be happy for anybody that I loved and cared for to use? It could be their mum, it could be their dad, it could be any other member of their family or a friend, indeed it could be themselves. But crucially, reason why I asked them to do that is because social care is about people. And one of the reasons why this is so important is that we're not talking about widget factories, we are talking about people and the impact of social care on people, which at its best can be transformational and be fantastic and supportive and enable people to live a meaningful and independent life. But at its worst, it can be absolutely hideous and have a really damaging impact on people, their lives, and on the lives of their families and friends. So never forgetting that it's about the people is the reason why I've used the mum test. And we try and drill into the mum test by asking whether services are safe, caring, effective, responsive to people's needs, which is absolutely crucial for people living with dementia, because we know those needs will change as the dementia progresses, and so we absolutely need to make sure that services are responding to that in an appropriate way. And last but not least, we ask whether the service is well led, whether it's actually making sure that there is a good, open, transparent culture which supports their staff, engages with people who are using the services, and works constructively with their families and their friends. So this is my mum. This is a picture taken on my wedding day. She's looking very happy because it took me 17 years to get David to marry me. So that's the reason why I use this particular picture. So, as I said, we published our State of Care report in October. And the reason for just dwelling for those few seconds on what we're here for is just to emphasise that when we're talking about these things, we are talking from a very strong evidence base. We're not making this up as we go along. We're not thinking, just I didn't dream it all up in the bath one morning. It is based on the evidence that we've been finding from our inspections and from working with others in the sector. And we did say that there was some good news in adult social care. Many of the services are providing good care. Over 70% are being rated as good, with another percent or so being rated as outstanding. And when we said that services needed to improve, about 3/4 of them did improve. And again, that is a very positive thing. And we saw some very good services, particularly in community services, services like Shared Lives. And we also see some amazing dedicated staff delivering care, which we have rated in over 90% of services as good and a further 2% of services as outstanding. And I think it's an absolute tribute to those people who are working in the service, doing a very difficult job, that we've achieved that kind of positive news. And this just gives you, I'll make sure that the organisers have got these slides so you can read these things at your leisure. But these are just some of the quotes that we have from some of the reports where we've identified really good or outstanding services. Absolutely critically is the focus on the people, enabling people to have a life, not just a service. But we did say that there was some worrying news. 1/4 of services, just over 1/4 of services, are rated as requires improvement, and a further 2% as inadequate. And although I will always praise and be positive about those good and outstanding services, we can never be complacent about these figures, because these figures represent an impact on people's entire lives. If you are living in a nursing home or a care home that is requiring improvement or inadequate, that is your entire existence, and it's just not good enough. We identified that we were worried about performance in safety and in leadership, and we were also concerned about the fact that services were not always improving when we told them that they needed to. And indeed, in some of those services that we rated as inadequate, 8% of them deteriorated even further. Rated them as it requires improvement, they deteriorated to inadequate. And this just gives you some of the examples of the poor care that we did see. Inconsistent leadership, poor environment, lack of training, lack of support, and a lack of dignity and respect being paid to people who are living in those services. And I think what's really important for us is to have in mind what is we're expecting from care providers delivering services for people living with dementia. That they need to enable support people, live their lives to the full, but absolutely critically see the person, not the diagnosis. And that shines through the good and outstanding services that we see, that is the focus. But we did say that we thought we were approaching a tipping point. And the reason why we said that was because of the concerns about the levels of unmet need that there are out there. You know, there have been fewer people receiving support from local authorities over the last 6 years. And we're also seeing, in the face of increasing demand, so older people, more older people, more people living with complex conditions that will require nursing care, we are seeing the increase in nursing home places stalling and possibly reducing, which I think is a real worry. And we're also seeing some providers handing back contracts because they don't think they can deliver the quality that they want to deliver. And I'm sure you all know about the challenges around the recruitment and the retention of staff. But the last two things that I wanted to say before I get thrown off the stage was that we could spend all of our time worrying about the money. But I think that we've also got to talk about quality. It's not just having the money that's important, it's what we do with the money that's also important. And I think that we have to be focusing on quality, and we have to be focusing on all of our responsibilities to make sure that quality is actually delivered. So we need to be listening to the voices of people who are using services, their families and their carers. We need to be supporting staff to be capable and confident in the really difficult jobs that they're doing. Providers absolutely need to be doing the job that they're paid to do and setting the culture, the framework and the expectations for their services that deliver on that quality. We need to make sure that commissioners and funders are actually thinking about quality and not paying the bare minimum and cutting corners on prices, which will have a direct impact on quality. And obviously, as a regulator, we need to be clear about the expectations that we're setting, monitor against that, inspect those services, but share our findings and take action if that is required. So I think that would be my rallying call to action for the rest of you to take on. Thank you very much.
Do these microphones work? Excellent, thank you. So our second speaker. Yeah, of course.
Okay, good afternoon everybody. Sorry.
The second speech gets sacrificed.
Okay, good afternoon everybody. Thank you for inviting me to speak today. My name is Jacqueline Cannon. I'm the CEO of the Lewy Body Society. We're 10 years old this year as a charity, and we're the only charity in Europe that is solely focused on funding dementia research. In addition to that, I'm a JDR, Joint Dementia Research Champion for Greater Manchester. We as a charity think that dementia and research just go together and is so important. 9 years ago, my dad was diagnosed with Lewy body dementia. He was very fortunate, if you could call it fortunate, in the fact that he was diagnosed first time by his GP in Wigan. At that time, there was no memory clinic in Wigan, but he had a GP that was responsible for GP training in Greater Manchester. And at least we were in a position that we knew what we were dealing with. That was a very difficult time, and 6 years ago, he lost his very courageous battle with Lewy body dementia. 18 months out of that 3 years, because it was a very, very quick decline, he had to go into a care home. Why did he have to go into care home? My mum was looking after him during the day. I was taking over when I came home at night after a full-time job. I was basically going to work on a maximum of 4 hours sleep. Because as soon as he went to bed, half an hour later, he would get up, put his coat on and say, right, that's it, I've been to sleep, I'm going out for a walk now. Yeah, that's the position we were in. The day he went in the care home, it actually broke my heart. You know, absolutely did. We didn't know what to expect. We had no experiences of care homes. I'm very, very thankful that that care home in West Lancashire, in Skelmersdale, was absolutely brilliant. The care home has continued to go from strength to strength. It's now a member of the Butterfly Scheme. Yeah. The care home had some experience of Lewy body dementia, but by the time that my dad left, they had a lot of experience of it because I made sure of that. But the caring doesn't stop when somebody that you have a relative goes into a care home. Yeah, you become part of a different family. I missed visiting one day in 18 months. Either after work or a weekend. We took him out every single weekend. If it was a summer's night, he went out in the car. He went on visits to various local places with members of the care home team. It wasn't just put him in a care home and that's it. We as a charity are getting more frequently contacted, because we're a UK-wide charity, from people saying that they can't find a care home that will actually, or a nursing home that will actually take somebody with Lewy body dementia. How can we discriminate against people with a certain type of dementia? Because, and not to use the politically correct term, because these people have become more challenging because the staff don't know how to cope with them. There were some people in the care home where my dad was, but the care home staff took action. They put in applications for funding and they got one-to-one care for those people. So it is achievable. The care home had a brilliant manager. She was an ex-army nurse. Yeah, and she run that care home perfectly. And even 6 years later, the care home still supports us as a charity. They support a number of charities, but they still support us. And the staff in there have been trained in Lewy body dementia, in other types of dementia, not just Alzheimer's. Because each of these different types of dementia require different care approaches that are documented, that people have a proper care plan that is in place, and that care plan is not just about sitting somebody in a room in front of a TV, because somebody with Lewy body dementia will not want to watch TV. It will actually make them more scared, make them more frightened if they're watching the telly. Because Lewy body dementia is not about memory, it's not about somebody losing the memory, it's about cognitive behaviours, about somebody hallucinating, about somebody having delusions, paranoia, and staff need to be trained on how to cope with that, and that is why we're getting these increased numbers. But I would just like to say that congratulations to Wigan Council yesterday for winning the Alzheimer's Award for the best dementia-friendly town. That's made me really proud. Thank you.
And kind of follow the questions that we were asked to confront in our presentations. And the first was the challenges facing us in social care, and of course the chronic underfunding and diminishing funding of social care is arguably the biggest and likely to get better, with local authority budgets having been cut at least by 40% since 2010. If you're a Labour council in the north, possibly by 60%. So there is a massive crisis in funding, and with a shift from council tax to business rates coming in 2020, if you didn't know about it, it's likely to get worse, along with, of course, demographics going in a direction that will demand more care. But I absolutely agree with Andrea that in the critical debate and campaign for proper funding of social care, quality has to run alongside everything we do. And it's very, very clear that we're miles away from the person-centred, relational type of care that all of us would like to see. And that's very important for us as a trade union and the work that we've done. But of course what's happening to the workforce is absolutely critical to that care, and you can't ignore the fact that over 200,000, largely women, because of course women are over 90% of the workforce, are earning less than the national living wage still. About 300,000 are on 0 hours contracts, and there is a 25% turnover of staff, which is not unrelated to working conditions. Most councils still commission without including the cost of travel time for home care workers, and that's why they're frequently not paid at the level of the national living wage. Also very concerning, of course, is the lack of training, and we've done some work with Community Care magazine looking at residential homes, and looking at CQC reports actually. In good homes, all of them have good quality training. In homes requiring improvement, only 2/3 have good quality training, and in those that are not satisfactory, only 1/3. So there's a direct relationship, and what's very clear is that many of our members, particularly in home care, only get half an hour on a video training before they start the job. Very, very little training for things like stoma care, catheter care, and all of that kind of stuff. What I also want to say, though, is that I think we should be making the absolute best use of public money, that there is, let alone the public money we'd like to see. And I realise this might be controversial, but I'm going to say it because I believe it. I think that the privatisation of care has been a disaster. And that isn't an ideological statement. I say that because I think what it represents is a huge drain on available money through profit margins, through, in the residential sector, the financing of debt, which is not accountable in any way to the public, and moreover the fragmentation of services that's resulted from privatisation. And alongside, I for one do not want additional public money just to go into the financing of debt and into hedge funds, and I think it has to be looked at. On sustainability, there are clearly huge problems with My Care exiting the market, Four Seasons giving us regular warnings, people exiting the market, providers exiting the market very regularly. And of course the impact on the NHS is enormous. We saw yesterday on the news the ambulance service saying that one of the reasons for the delays in answering calls is because of delayed discharges, meaning that they can't actually deliver people in their ambulances to hospital. They have to wait for very long periods of time because there are no beds. That's just the ambulance service, and we all know about the problems for those needing care, their families and hospitals, about delayed discharges. I think STPs and combined authorities provide some opportunities for possible integration, but I think STPs really, there are some big question marks over them, over the public accountability, over the transparency and ownership, actually, who owns these STPs, how are they going to work, and who's going to make them look more closely at integration. I think there are some opportunities for the workforce. We have our ethical care charter, which we have asked local authorities and providers to pick up. In order to be a full signed-up member, you have to pay the living wage. You have not to commission 15-minute visits. You have to put care, quality care, at the centre of your commissioning practice, and you have to pay occupational sick pay, which doesn't sound like a lot. So far, 20 providers have picked it up. It's slow because, of course, councils don't have the money. But those who have, like Islington, have found that actually, by paying the living wage, reviewing contracts and bringing some of them in-house, they're saving money because they don't have providers crisscrossing the borough, staff retention is higher, staff commitment and satisfaction is higher, and they're able to pay higher rates of pay and travel time as a consequence of reorganising and rationalising the service. We're also being forced now into taking employment tribunal cases for those not paying the national living wage, and we've got about 30 going in Haringey, where some of our members were paid £3.85 an hour by a private company, commissioned by Haringey, and we have big campaigns going in the North West region and East Midlands, where we're actively now looking for cases because we believe that only by bringing this to a head is something really, really going to be done. I think Brexit poses an enormous challenge in terms of the care sector. Of course, we don't yet know what's going to happen exactly to all the migrant workers working in the service. But if there is a big impact on the number of migrant workers allowed to stay and work here, then clearly that's going to have a massive impact on care, and we need to look at that. So it's very tough times, but also from the point of view of those working in care, you could argue it's a seller's market. So there are opportunities, I think, for them to push for greater development and more control, perhaps, over their working lives, which is something that we certainly want to see.
Thank you for that. Not that my role is to stir up controversy, but having heard the privatisation is a disaster, we now come to the provider on my left.
Good afternoon, everybody, and thank you very much for having me here today. It's a real pleasure to come along and have the opportunity to share my thoughts on social care challenges. So my name is Dominique and I'm the Chief Operating Officer at the Good Care Group, and I'm incredibly proud to say that my service is represented in that 2% that Andrea put on the board. We recently got an outstanding for the care that we provide. And for me, it's absolutely about improving the outcomes that people should rightly receive when they're having care in their own homes. We provide living care to people in their own homes, so we're all about enabling people to stay at home wherever that is possible, and we know that over 90% of people given a choice would choose to stay in their own homes. And having said that, whilst I am a huge advocate of the service we provide, one of the things I feel very strongly about is that this challenge that we face is a cross-sector challenge, and we are not going to solve it unless we collaborate. And that is really, really important. We have an ageing population, we have an increase in progressive neurological conditions, the demand for care is growing, there is a huge lack of integration. We provide services across England and Scotland, and the difference in the collaboration across the different counties is quite remarkable. We see people buying care in crisis. The clients that we care for are always buying at a time when they come to crisis, and quite often those decisions aren't always objective ones, and we as providers have a responsibility to hold their hand and provide a service through their choice that might not be the one that we provide. We need to create an environment where people can plan, and we have foresight. We have major issues with bed blocking and pressures on the NHS. 65% of bed stays are emergency admissions. If we could solve that problem, we would have a very different place from which we are starting. The funding crisis already alluded to. And for me, one of the things I feel really sad about is the negative media focus on our sector. I've got a 14-year-old daughter, and she said to me this week, "Mum, you're a great role model." And it's really interesting because I went into her school last year to do to champion our sector, and I didn't do the Good Care Group, I did come work in care. You would not believe the wide berth that was taken by parents and kids of the stand that I manned, and I kid you not, I started doorstepping people just for the fun of it. Because I feel so passionately. I fell into the sector, I didn't choose to work in care, I was asked to work in care. And I love what I do, because what I do makes a difference to the people that I care for every single day. Every decision I make impacts on the people that work in my service and the people that receive my service. And I feel really responsible for that. We have got to create a movement that starts with our youth and the kids out in our community who, quite frankly, would not touch this sector, they didn't, they just won't come near it. It's a real issue for us. Brexit and the workforce challenge we face is immense, and it is not to be underestimated. We value the difference of the carers that work in our service. It's really important to us that we have a diverse and valued workforce that is celebrated for the difference that brings and the cultural difference that brings, and we must not lose sight of that. And because our sector is so poorly funded, we've got a real issue around the use of things like technology. We just lack innovation, and there's a huge opportunity to make a difference there. From a sustainability perspective, we talk about health and social care, and actually I'd love to just remove both of those words. We have a whole system issue, and it's something we are only going to fix if we work together. Public awareness, it's not just a health and social issue, it's a public awareness issue. You know, we have got to get people creating a movement, and people don't, one of the issues that I kind of, hear, people don't care about care until they need it. People don't care about this issue until they face it. So how do we create a movement that engages people that right here and now are not moved by it because they don't need it? And I think that's the challenge we face. How do we, the people in this room, there are lots of faces here that I see at lots of different events, and we need to get out there and start to create an impact with people that currently don't even see this as a problem. And frankly, until we do that, we are not going to get the funding this sector needs. We need to create a place where people feel valued for what they do. Caring is hard. It's a very often unrecognised but very skilled profession. As I say to my team, it's not just hard graft, and to put frankly, it is hard graft. Our professional carers are skilled communicators, especially when they're working with people living with dementia, and they're having to undertake what I call mental acrobats every day and be creative in the way they care for those people when they want to put their coat on at 2 o'clock in the morning and go for a walk after half an hour's sleep. And that's a skill that we have a responsibility to recognise. I would like to see providers come together, forgetting who they are, focusing on the issues that we face, providing a solution that is cross-functional. So when I talk about that, what I mean is home care providers, care home providers, hospital providers, putting to one side the things that they are targeted with and creating a service that truly puts people at the heart of what they need, and that provides them with the care that is right for them, irrespective of whether that's home care, care home, or whatever the environment, supported living, whatever the environment might be, but actually starts with the person, the funding they have available to them, the care that they want, and then thinks about where they actually end up, if you like. And I think until we turn this model on its head, we are not going to see a difference in this sector. It's not just about care, it's about making a difference to the whole community, raising awareness of dementia and the prevalence that it's going to have. It's going to affect 1 in 3 of our kids. We need to start engaging them and being a part of making a difference.
To be at another DAA meeting, and every time I come to DAA meetings, I'm really energised by the amount of creativity, the amount of commitment in the room. And one of the things that I really like about these meetings is that they're full of a diverse group of people. And picking on what Dominique has just said, actually we all need to work together if we're going to get through a very tricky time. I'm not going to be as kind as Heather and strict to my script. I'm going to go a little bit off-piste because I think the other panellists have very eloquently outlined some of the major challenges that we face in social care. And I think part of our challenge is that we are in a position where dementia, because it is predominantly a condition of older people, suffers from all the ageism that is within our system. And I think that the ageism is one of our biggest challenges. I was mindful of this when I was surveying care plans and I was looking at issues for younger people with other disabilities recently. And I found wonderful examples of beautifully tailored care packages for younger people, some of whom were living in their own home with several people on round-the-clock care and support packages. Have you ever seen a person with dementia offered that as the potential for their health and social care support? So I think the first thing that we've got to do is confront the fact that ageism is absolutely at the centre of our system. It is the final ism that is still allowed to be part of today's society. It is the final ism where people can make casual jokes. The final ism that is completely ignored by people like the Equality and Human Rights Commission. It's interesting as well, and Andrea will know from her role as the Chief Inspector, there are issues about, for example, whether or not people will register care services for people with learning disabilities that are beyond 6 people. And yet the reality of older people's care is you can only make it pay if you're delivering services for about 90 people. Nobody has ever said to me, oh, I'm a real disciple of Schumacher, I want to have small is beautiful in care services. But they never say, well, that applies to older people's services or to people living with dementia and their care. So I do think ageism is a real challenge. Another thing that I think we really suffer from is, on some levels, very poor political leadership. We certainly had a lot of support from the Prime Minister, but what we are moving towards is a group of politicians who, first of all, don't think about how policy will become real, have no mechanism to call people who are supposed to be delivering to account. So what we see are politicians who will tell you endlessly that you as a service user should be expecting high quality, personalised and bespoke care, but at the same time leaving everything to localism and not challenging it when it's not happening in areas. Last night, Andrea and I were at an event and they were discussing the care home vanguards. And I looked at a map of the United Kingdom and I saw a few little pinpricks on that map. And I was listening to a presentation which was frankly pedestrian. It talked about the basic things, and they were pretending these were exemplars. I mean, things like transferring information about a person when they move between a health and social care service, and telling me that somehow this way in which they were doing it was revolutionary. Actually, those are things that are givens that should be happening as part of a service. It is not an exemplar of a service to be able to say we pass information about somebody when they come out of a hospital or go to a care home or vice versa. That should happen absolutely naturally, and it should be part of the system. And I was also mindful when I looked at that map of these so-called trailblazers, vanguards, that frankly, if I was a person living with dementia who lived in Suffolk, it was of no interest to me whatsoever, because there was no service in Suffolk, there was no vanguard. So there seemed to be also no strategy to mainstream things. So one of the irritations that I have is as I go around the country and I see pockets of good practice and nobody mainstreams them. And if I'm not in the area where the pocket of good practice is, it's of no use to me whatsoever. So I think we should walk away from this notion of endless approaches to localism. Localism should be based on something substantive, which is about a response to local need, not just letting anybody do what they want because they've always done it. And that is part of the problem with localism. I have to say also that my view about localism is it's the Linus's blanket with which politicians at the centre surround themselves when they can't have the guts to take responsibility for the fact that the expectations they've raised haven't been delivered. So I think we need to refocus our approach to localism, and it needs to be about local need, not just about throwing the responsibility into the long grass. And I think that's one of the challenges that we face. The other issue is about fragmentation. And I think Dominique mentioned it, I think Jacqueline mentioned it. Part of our problem is that there is an obsession with whether or not it's a health pound, or a social care pound, or a community pound. Well, let me tell you, it's a citizen pound.